So as a paramedic here, me and Rochelle are going to assess my patient. We go through our empathy, we go through our primary assessment and our secondary assessment. We ruled out any spinal injuries, and now we're going to palpate and figure out exactly where the injury is. We're going to splint it and move him to the hospital. So we go, so palpate down your arm, okay?
Okay.
Let me know where the pain is.
That's all right. That hurts.
It hurts? We're going to mark it right there, get a visual. Let's go the other way, okay?
Okay. That's okay. Stop.
Stop. So we locate the pain right between there and there. Now we're going to do, we're going to do a quick test to see the neurological abilities in his left arm, and then we're going to splint it. Okay, so I'm just going to take your pulse. When I'm doing that, can you wiggle your fingers a little bit? Okay. Can you feel a finger touching?
Yep.
Okay. Do the cap refill. Everything is proper there. So now I'm going to get my splint. I'm going to mold it to my arm. When molding it, I'm going to make sure it's secure around the edges and it's a good grip. Now I'm going to ask my assist or my other paramedic to help support the arm as I place the splint on. How's that feel?
A little too long.
A little too long. So what we're going to do, we're going to make the end right here a bit more comfortable for his size. Okay. Do that again. How's that feeling?
That's better.
That's better. So now I'm going to rotate the arm in. I'm going to support for a quick second as my other paramedic gives me the splint. Just the gauze. And now we're going to wrap distal to proximal. It's very important here to make sure everything is tight. That way the splint is actually secure and stabilizing the arm. When doing this, I'm keeping in mind the fact that I don't want to move his arm around too much. Get right there. Yeah. And then we're going to go over where the injury is to keep it exposed for further monitoring. We're going to be very careful around the injury. And I'm going to tuck it in just in case I need further use later on. Okay. Now I'm going to help with the patient's arm in a more comfortable position around his chest. Am I supporting that? I'm going to grab my triangle bandage. I'm going to sling your arm, okay?
Okay.
So when doing this, get underneath the arm, making sure everything's supported with my other paramedic. And then I'm going to tie the sling. When doing this, I need to make sure that the arm is fully supported on both sides and that it's tight up top. Okay? After doing this, I'm going to see the weight's been taken off. How's it feeling?
That's okay.
And before I transport, we're just going to do another check. So we're going to check his fingers, check his cap refill. Can you wiggle your fingers around?
Yep.
And can you feel the finger I'm touching right now?
I think.
So now that you've checked the second neurological test, we're going to go to the hospital.